in a very interesting disease called fibromyalgia, we have a really strange phenomenon happening. The cause of pain in fibromyalgia patients is this fibrosis. Why is it that fibromyalgia patients can be given all the pain meds on the planet and it doesn't alleviate their pain? Why is it that fibromyalgia patients can be given all the psychotropics on the planet? You can Prozac a fibromyalgia patient until they don't know where they are or who they are, and it won't change their pain one whit. And for this, we have to touch just a second on cardiology. When a patient has a heart attack, the doc knows that heart's going to hurt for 3 solid days. And yet the doc knows he's not going to give him any pain meds because they won't work. Why? The pain is the pain of something called ischemia. You've all done it to yourself. You've all experienced ischemia. When you were kids and you put rubber bands around your wrist and you saw how, wow, purple, that's really neat. And then after it turned purple, it began to throb. And the more you tried to move it, the more the sucker throbbed. And the more it hurt. You could have mainlined heroin right then and there, and that hand was still going to hurt. What took away the pain? When you took away the strings of the rubber band and you restored the circulation, the oxygen supply to the tissue caused it to stop hurting. In fibromyalgia, we have a complex mechanism, a multidimensional mechanism, where stress and estrogen dominance and fibrosis production from the estrogen dominance produces a lot of this scar tissue in muscle tissue. And it's just like putting the rubber bands around your wrist. All of a sudden, you've got these knots of fibrosis, fibromyalgia. Everyone thinks about the symptoms of fibromyalgia, but no one gets to the root cause, the fibro in fibromyalgia. You have all this interlacing of the fibrin in the muscle tissue, cutting off full circulation, plugging up the little microcirculation that feeds that. All of a sudden, you've got pain. And the pain meds won't deal with it. The psychotropics aren't going to deal with it. The pain's not going to go away until you put in the enzymes to eat away at the fibrosis. There are very few, hardly any, fibromyalgia patients below the age of 27. There are very few, if any. And those patients who are younger than 27 who do have fibromyalgia, you can show that they have enzyme deficiencies. What causes this laying down of fibrosis? I mentioned stress. We all have it. I mentioned estrogen dominance real fast. Guys have it, gals have it. We get estrogen from petrochemical fumes. We get it from synthetic fertilizers. We get it from the pesticides that get sprayed on food. We get it from soy. Any isoflavone is an estrase. These substances increase the amount of fibrin production. Since the stress has already challenged the immune system, and your body's running low anyway, then the body will just lay down fibrin and lay down fibrin and lay down fibrin. The enzymes will eat away the fibrosis from the fibromyalgia. The enzymes will eat away at the fibrosis from postoperative scar tissue. The enzymes will eat away at the fibrosis that is creating the matrix for arteriosclerotic plaque in the arteries. Dr. Hans Neiper, famous German-Swiss scientist, German-Swiss physician, for 30 years used serrapeptase to open up the blood vessels. He called it the poor man's chelation. Serrapeptase 3 times a day, and in 2 years, actually took less, the patient would have a completely open vascular system. The enzymes will eat away at the fibrosis, clogging up and shrinking the internal organs. There's a story I have to tell you here. Dr. Karl Ronsberger, a man I spoke of before, was diagnosed with severe glomerulosclerosis, scarring of the kidney, of the internal filtering portion of the kidney, in 1970. They told him he would be dead by 1973. knowing the fibrinolytic activity of the enzymes he was making then, he would walk through the plant and grab a handful of his own enzymes several times a day and swallow that handful down with some water. He just died last year, 28 years after his death sentence was pronounced. Why? The enzymes ate away at the fibrosis that were clogging up his kidneys.